the recording. Yeah, okay. Good afternoon, everybody, and thank you for joining us again today for the second session of this week on the SADC TFCA webinar series. Today we have a roundtable discussion, so it's more of an open floor for us to hear the experts on the specific topic of the day, and then engage with your experience and your queries on the issue that we're going to be talking about. And today, we are on the multiple impacts of the Covid-19 pandemics on SADC TFCAs. And the moderator for today's session is Dr. Nyambe Nyambe, who is also the head of the Kavango-Zambezi Transfrontier Conservation Areas Secretariat. Before I give the word to Dr. Nyambe, let me just remind you of a couple of housekeeping rules for today. May I ask all the participants to please use the chat box and write your name, institution, and country for our records, and also use the chat box to ask your questions. When we pick them up, we will then unmute you and give you a chance to ask the questions directly. You can also raise your hand, but also then in that case, be patient until we mention you and we activate your microphone for engaging with the experts and the participants. So without much further ado, let me welcome Dr. Nyambe and the experts for today, and thank you for joining us once again.
Thank you very much, Clara, and thank you everyone for joining this webinar, whose theme is the impact of COVID on SADC TFCAs. And I'd like to believe that with the current COVID pandemic, we are all part of an extraordinary time in the sense that we are collectively being awakened to the realities of COVID, and we are seeing changes in large socio-ecological systems and even economic systems. And to help us with this webinar, we have a panel of distinguished colleagues. And let me just quickly introduce each one of them in no order of priority. I want to introduce Marcus, Dr. Marcus Hofmeyer, who's a wildlife veterinarian. Formerly worked with SANPAX for close to 18 years, and he is currently the program officer for the Wildlife Conservation Trade Portfolio of the Oak Philanthropic Foundation, and he's previously played other roles in OIE Wildlife Working Group and also the Kaza Animal Health Working Group, and also previously in the other working group in Greater Limpopo TFCA. Then maybe Marcus want to say hi to everybody.
Hi everybody.
Thank you. Then we have Dr. Joshua, who is currently working with WWF South Africa and also leading the Africa Network on rhinos. And she has previously worked with traffic, and her interests are basically in key biological management and monitoring issues. And she has authored on the South Africa-Vietnam rhino horn trade nexus. And so she's also been very heavily involved in basically community-based natural resource management, and also in her new portfolio where she's the senior program manager in WWF, leading work on the wildlife program at WWF South Africa. Joe, you may say hi to everybody.
Hi everybody, thanks Nyambe.
Thank you. And then we have Professor Lucille Blumberg, whose journey in medicine has brought her closer to zoonotic diseases, because she has worked with wildlife veterinarians, and she's currently with the national, what did you call it? The National
Institute for Communicable Diseases.
Yes, and through her work, basically, she's seeing what's happening in terms of COVID at the national level and observing what is happening at the international level. And I don't think we could have brought a better panel than what we have. So colleagues, welcome the panelists, and we get started. I would like to begin with Marcus. As you know, Marcus, as you know, TFCAs have multiple objectives, and one of these relates to ecosystem health at landscape level. In that context, scale really matters. What role does scale play in promoting ecosystem health, and what links do you see with zoonotic diseases like COVID-19?
Okay, thank you, everybody. As you are all aware that TFCAs, or when they were first started in Africa, called peace parks, was specifically put together, and the concept was put into action to try and create landscapes that are ecologically linked across boundaries, and therefore creating, in a way, what we would call healthy ecosystem landscapes with different levels of use and being a better platform for people that live in that area to improve their livelihoods. So what we are seeing more and more now across the globe is, with global environmental change impacting heavily on ecosystem health and fragmented habitats, we're forcing wildlife and livestock and people to live more closely together, and often in very unnatural conditions. The COVID-19 outbreak can probably directly be linked to the unnatural and the very stressful way in which wildlife is being handled in Southeast Asia, diseases spreading from wildlife through potentially other wildlife or even domestic species, and eventually entering humans and then adapting in humans to become human-to-human transmission and causing a pandemic. If we have ecosystems that are interlinked, where there's enough heterogeneity, patches of heterogeneity that can actually allow wildlife to live in a natural environment, then the interfaces and the risks associated with the interface can be much easier managed. So these are all very novel approaches that everybody aspires to, but from my own experience working in the various TFCAs, particularly on the animal health groups, it is not so easy to implement this in a realistic fashion. It's very conceptually agreed to, but when you go into the landscapes themselves, there's often discoherence between the different development levels and impact on the environment. So we're hoping that this COVID-19 lesson that we're learning from a global perspective can help us actually, again, put the whole transboundary ecosystem health approach on the agenda, high on the agenda of all integrated and sustainable land use options. So again, to reiterate that what is really, really important is that if we want to be able to coexist with nature and prevent zoonotic transmissions, we do have to have healthy ecosystems. That means that animals that are being produced for food, not only wildlife, but livestock as well, is done in a manner that's sustainable, high regard for welfare, and that the products of those animals are produced in a way that is safe and healthy for people to eat. If you force wildlife and livestock to live together under natural systems, the chances of diseases spreading between the two is much greater, both from wildlife to livestock and vice versa, and that's becoming much more of a bigger risk. And TFCAs is one way of managing to overcome some of these degrading landscapes and reverse the process. So I just wanted to stress, and with the very limited time that we're given to talk about this, how important it is to have ecosystems that function naturally at a large scale. The CASA Animal Health Working Group has just recently been discussing the deaths of elephants in northern Botswana, which is most likely, we don't know the diagnosis yet, and the Botswana vets are working very hard at finding it out. An alignment of environmental factors that probably caused that, but again, being able to understand what is happening there will give us a better set of tools with which we can either prevent that or at least manage the risk of it spreading to other areas. And these are the realities that are often very difficult to implement given national borders, national policies, and very disjunct and varying scales of ability to deal with disease diagnostics and quickly respond to them. So with that in short, I just wanted to thank you again for allowing me to be on this forum, and I look forward to the questions that will be asked, and hopefully we can expand the discussion more. So I think I've used up all my allotted time.
Thank you very much, Marcus. Indeed, you've just reaffirmed the point that I made earlier on a collective awakening in terms of what the COVID pandemic is doing for all of us, and the changes that it is bringing about in terms of the large social ecological systems and also economic systems. And I think obviously you spoke about the whole risks that relate to public health. And Lucille, may I just call upon you to speak to this question, and in particular, drawing on the experiences of COVID pandemic, how can TFCAs contribute to mitigating or reducing the spread of zoonotic diseases to human beings?
So, yes, good afternoon, everyone. I hope you can hear me. I've seen many old friends joining this program, and it's great to see you. I have to say, I'd love to be in the Middle Zambezi Biosphere Reserve rather than sitting in the eye of the COVID storm. It's really hectic and has turned human health and economic systems and public health systems on their heads. And what we're seeing now seems to be eons away from the likely zoonotic source and TFCAs. And I think people need to be reminded that going in at the back end, developing vaccines and chemotherapeutic agents and diagnostics, while very important, is not the only part of addressing these pandemic zoonotic threats. So if we look over the last 25 years that I've been in this field, zoonotic diseases have accounted for a very large number of epidemics and pandemics. We only have to think about Ebola, avian influenza, MERS, SARS, Nipah, Rift Valley fever, yellow fever. But on the human side, they're very under-recognized, underdiagnosed, and underappreciated, probably falling between all the other huge burdens of human health, non-communicable, some communicable, big outbreaks, HIV, TB, malaria, but we're not taking them seriously. I think TFCAs give an opportunity to work outside of the human health silo, and human health is very siloed. I think the animal side and practitioners there do it a lot better. But TFCAs allow you to work across boundaries, out of your silos, and work with other practitioners to address the threats, the evolution of these pathogens in a much more holistic way. And I think what we're seeing now is a failure to do that. SARS-CoV-2 is not going to be the last. It's just one of many. And I don't think that we learn lessons. Although people say, well, we must address wildlife, illegal trade, better husbandry practices, work in these One Health programs. I'm not sure we've actually learned that. So I think TFCAs bring a lot in terms of, and many lessons to create healthier environments and to work outside of our comfort zones and silos to look at root causes and why things are happening. And I think I'm going to stop there. Better use of natural resources and all the things that Marcus has said, I really want to agree with 100%. Thank you.
Thank you very much, Lucille. And I think one point that you've stressed is how we can work outside our comfort zones. And which brings me to the question of how TFCAs can actually help in terms of promoting collaboration across sectors, across disciplines, and across countries. And I wanted to pose this question to Joe. How do you see the role of different sectors in responding to COVID-19 and the importance of transboundary collaboration in dealing with pandemics in general?
Thanks. And ditto to Lucille, lovely to see so many familiar names coming up. I think, absolutely, again, repeating Lucille, this is about stopping silos. We also naturally fall into our own little blinkered area of focus, but we absolutely need to use this opportunity to build on what TFCAs have already taught us about better collaboration, to work across, even more broadly across different sectors and issues. And I think really there are three, maybe four main lenses and a suite of possible solutions for us to be considering here. Obviously, primarily health, public and animal health, so pulling together across veterinary, agriculture, public health, and then linking conservation and protected areas into that, as Marcus has flagged from the kind of ecosystem health perspective. There's growing number of examples of wildlife source diseases impacting humans. And as I think Lucille has also suggested, can we be more preemptive through an environmental epidemiology approach, which allows us to identify disease risks earlier and be thinking now about policy or legislation change that might be needed. So rather than focusing too much now on the symptoms, digging perhaps into likely future causes. Secondly, I think the socio-economic lens, the livelihood lens we've flagged, but is really critical. So in early April, there was a World Bank report that predicted Africa's economy could shrink by as much as, well, over 5%. And an African Union report estimates that nearly 20 million jobs are threatened to be lost across the continent. So we know rural communities may fall back on wildlife and other natural resources during times of economic hardship as a coping mechanism. We probably can expect to see increased exploitation. How do we respond to that in a way that isn't just enforcement, but again is preemptive and proactive to meet food security and economic needs, ensuring that any use of natural resources is sustainable? I think not only the community sector, but the private sector, the wildlife ranching industry in South Africa has been hit very hard. Can we look at domestic and regional markets as a way of resolving that challenge? So this need for collaboration between disciplines for conservation and development sectors to work together on strategies to resolve this. And across sectors, yeah, so how do government link with communities, with NGOs, with private sector? I think there's been a good example of this in the Greater Kruger landscape in their COVID response, founded on the Greater Kruger Strategic Development Framework. And then I think the other big challenge in terms of resources or economics is the impact of the loss of revenue from the tourism sector on all of our protected areas. TFCAs at a national level, at a provincial level, at a local level, greatly reduced operating budgets, risks of job losses. Can we promote resilience across TFCAs by working across borders to promote more domestic tourism or regional tourism in the shorter term? How do we adapt to a potentially long-term change to the international market? Do we need innovation in tourism responses there? I mean, I think maybe the CASA visa is an interesting model to consider. I think Marcus has flagged the One Health as a strategy that we should all be buying into going forward. This will automatically help us cut through these silos, bringing in a public health response and animal health response, plant health, wildlife management, looking at wildlife use and trade, conservation, and then laying even climate change on top of that. So how do we pull that in, again, at a national, regional, international level? In terms of possible solutions, way to promote collaboration, should we be looking at multi-agency and multidisciplinary transboundary task forces to look at implementation of COVID responses that bring in people from the public health sector, from with socio-economic perspectives, with conservation wildlife backgrounds. Could we utilize existing monitoring systems in TFCAs for early detection and response to emerging infectious diseases? Could we link surveillance of those to existing biodiversity monitoring programs, perhaps? And I think finally, and I think Marcus touched on this at the beginning, TFCAs are a great model in helping us promote a more holistic response to these kind of challenges and mitigating future threats by recognizing none of these pandemics can be addressed by any single country in isolation, but by their very nature, we need to respond in a transboundary way. Thanks.
Thank you, Joe. Listening to the three presentations, I pick up some very interesting perspectives. One is that scale matters. The other one is that there's a lot that we don't know, so we have to be operating in a learning mode, continuously learning about our environment, our socioeconomic challenges and the political spheres. How can we better organize ourselves? The other element that I'm picking up is that of our surveillance, also feeding into how we learn. I think all that calls for a lot of courage at the institutional level to think and act differently. In fact, in many spheres. So I think what we're going to do now is to encourage the listeners to submit their questions and also raise their hands if they so wish, so that we engage the panelists with very specific questions. It would be helpful if you can target your questions to any one of the presenters, and also if you want to keep it open, please indicate. That would help us a lot. So I think I would like to open this up to now just some questions for the panelists. And I think I need help here to check on any hands that may have been raised, or that is any questions in the chat box.
Good afternoon, it's Clara again. Nyambe, there are comments for now, which is always good, from Ashwell and from Paul Boucher. So Ashwell, if you would like to unmute yourself and provide your comments for engagement, and then I'll give the word to Paul. Thank you.
Oh, I actually wasn't going to pose any questions. It was just reinforcement of Joe's thinking. But having heard some of the other inputs and insights from Paul and things, I think a socio-ecological systems view is almost kind of part of where we need to also think as well, that threads all these silos together, because I think many of us in different disciplines struggle. Our starting point, we actually struggle more on how to engage each other around, I suppose, not to use threat language, but a common threat because of our limitations. And I think the transboundary working kind of model certainly has shown its value in other forums and in other needs, like more specifically on wildlife crime and those kind of things. So yeah, that was all I was going to say. But thank you, Joe. You definitely hit the mark for me in that.
Thank you, Ashwa. We have a comment from Paul. Paul, would you like to speak to that comment that you just made?
Thanks, Nyamba. Yes, it's just about the, talk is cheap and it's easy, but it's getting those samples across the borders that's difficult. It's not just in CASA, but in other TFCAs as well. It's that collaboration of getting researchers to be able to move freely within a landscape and not be limited by research permits within a specific country or a specific area.
Hello, Paul, or is it just me who's
actually breaking down those actual barriers to movement?
Okay, now thank you very much for that. Would any one of the presenters wish to speak to those two comments?
If I may quickly just talk about that, yes, I think it was a point I was hoping to highlight through some of the questions, is that, you know, if we truly want to try and work in a transboundary fashion, we do need to have cooperation between the countries, that particularly in the areas where that agreement is first and foremost part of what is trying to be achieved with the transboundary, be it a park or a system or project. There needs to be on the ground activities that allow for those activities to take place without too much hassle. And certainly in my own experience, that's often where you hit the first roadblock, is that yes, at a conceptual and at a high level, political level, people agree that this must happen. But then if you try and actually implement it at a on the ground bureaucratic and national level, there are many procedures you have to follow, and it just becomes basically a normal cross-border procedure. There's nothing that really makes it easy to work across boundaries. And I think we need to also, in the context of COVID, where people have closed their national borders even more strictly than it was before, we need to maybe take a lesson from this and sort of analyze why is it so difficult to get these things right, because diseases don't respect borders. We can close borders, but somehow people will still find ways to move. And if you take disease as the vector, it will get across the border. So the more fluid and flexible people that have to diagnose and find out what are the causes, the quicker you can find risk mitigating measures that are applicable at a local scale, and then scale it up from there. So I am very worried that the COVID outbreak has actually reversed a lot of the gains made with trans-frontier conservation activities, and it's made it more difficult to work across boundaries rather than easier. And we do need to take that into consideration and quickly find ways in which we can unlock those transboundary opportunities again. Thank you.
Thank you, Marcus, for that. There is a question from Rebecca. Rebecca, might you want to speak to the question?
Hi, thank you. Thank you all. I appreciate the chance to be here, and it's good to hear your voices, and nice to meet some of you who I haven't met before. So I'm a researcher based in the United States, as you might have already heard from my voice, and I've been working in Limpopo National Park for quite a while now. So I'm particularly interested in Limpopo National Park, but any communities living in TFCAs, especially those who are particularly vulnerable. I realize the vulnerabilities are widespread and really dynamic, but do people know, what's the situation in terms of infection rates in communities living in TFCAs? I understand that public healthcare workers sometimes can't go to communities, and already, for example, in the villages internal to the Limpopo National Park, the access is already poor and sporadic. So I'm curious about those questions, as well as for rangers. Yeah, how are people and what's going on within the TFCAs?
Thank you. Any one of our panelists to speak to that?
Yeah, so I can speak to that. And hello, Rebecca. The last time I saw you, we were on a One Health trip in the Greater Kruger, part of, I guess, the Greater Limpopo TFCA. Are you referring particularly to COVID or to other zoonotic diseases? In terms of COVID, probably fairly low at the moment. Most of COVID is concentrated in the metropolitan areas, because that's where it was introduced first, and when people live most closely together. But certainly as the pandemic expands, I can only speak for South Africa, we can expect other cases. In terms of people working in the Kruger National Park, there was a concern. COVID was brought in by tourists, so there's another concern, but didn't expand. It was just before the lockdown, and I think that probably prevented further expansion into those areas. In terms of zoonotic diseases, as you know, we've been involved in an ongoing project in the TFCA, looking at various zoonotic infections that were identified by working with the vets, by working with One Health people, working across the boundaries and outside of silos. Very under-recognized, probably not a major cause of severe disease, but certainly does cause some burden of acute febrile illness, and we haven't explored them all, but we did look at people working very closely with domestic animals, which in that area have quite close contact with wildlife, and rickettsial diseases, no brucella, I think rickettsial diseases, things like Q fever, were not uncommon. But what was interesting is that because they've had such long exposure over many years, the severity of disease, probably in adults, has been mitigated by early infection, good immunity, and not major severe disease in the older age group. But for many TFCAs, these studies have not been done, and clearly there's a big gap. Others can add.
Thank you, Lucia.
Yeah, if I can just add to that, that in particularly the Kazat TFCA and the GL TFCA, the Greater Limpopo TFCA, there's obviously quite common interaction between wildlife and livestock, and certainly zoonotic diseases, as Lucille pointed out, are not high on the agenda of what's making people sick there. It's often nutrition related, it's common human diseases, it's socioeconomic conditions that are often very difficult for people to make a good living there. And certainly livestock are generally very immune as well. And this brings me back to the point I made earlier, is that a healthy ecosystem and healthy systems does set both livestock and wildlife up to be in good shape to use their body's own immunity to prevent diseases from becoming clinically active. And that's really what you want to try and achieve in the long term, is to have a situation where you don't have to treat many diseases, but you have a management or a systems approach where animals' immune systems, humans' immune systems are healthy enough that in the greater scheme of things, mostly can deal with the diseases that they're exposed to, as Lucille pointed out. Thank you.
Thank you, Marcus, for that. I don't see any hand or question, and maybe this is just time for me to make one remark here. I'm hearing a lot of statements suggesting that we probably, as a species, as a human species, we have underestimated just how everything is connected. So the whole issue of interconnectivity, and then also we probably have underestimated how we can work together better and the agency for that. So with that in mind, I would like to just check if there is a question here from Holly. Holly, over to you.
Thanks, Nyambe. And this is sort of a question to all of you, including yourself, Nyambe. You know, at times like this, it's obvious that information becomes king. Information is needed for so many different reasons and for so many positive reasons. But it seems that also at times like this, those that have the primary information that's the most important, you know, from the ground level, are incredibly overstretched. They have the limitations we've just been hearing about, and others who are maybe one or two steps up begin to become sort of information brokers, and somehow that information takes on power, and sometimes it then becomes difficult for people to get at the information that they need. So I think, you know, you guys are doing a wonderful job of trying to bring this together and help us all share information the best we can. But I'd really be interested in hearing from anyone on the panel and yourself, Nyambe, as to whether we have any ideas, you know, where we could quite proactively help. I think to break down whatever silos start occurring of, you know, ownership of information, or being able to hold it and hold it ransom almost for donor money, donors that need information. How can we help each other? Because this is something that is within our practical grasp. And I'd be very interested to hear from all of you or anyone who can share with me their wisdom on that. Thanks.
Thank you very much, Holly. And maybe let me begin with asking any one of the panelists to speak to that.
So thanks, Holly. I mean, I wonder if this idea of a multi-agency task team within countries, but then also across borders, might be one way that we could help solve that by building on people working together and encouraging them to share information and data and other findings. And then to your point on donors, picking up Ashwell's point about systems thinking, is there an opportunity here for us to influence the international aid agencies and other donors into thinking in a more transparent way, thinking kind of the systems thinking approach and breaking down silos between agencies, between institutions, and encouraging more collaboration and information sharing?
Thank you, Joe. Marcus, Lucille, do you want to add to that?
I might just give and maybe use the case study of the elephant deaths in northern Botswana as an example, where it's obviously within the sovereign boundaries of Botswana, but it is a core area of the Khaza Transfrontier Conservation Areas. And there's been some significant difficulties in getting collaboration due to COVID restrictions and not being able to move across boundaries. Information sharing has also been confusing a little bit, and then it got into the media, and everybody is now literally having opinions of what's going on there. But at the end of the day, what would have been, for me, a very transparent and a logical approach would be for the Animal Health Working Group team from the different countries to get together and actually do a full investigation. There are labs in and around that area that can do the analysis quite quickly, or at least guide the investigation in a certain direction. Yet this has not happened in an easy manner. So I agree with Holly that there's difficulty in getting transparent communication and information sharing. And I think that should be a fundamental component of future TFCA development, is how do you empower people on the ground to be able to share information responsibly, so that at the end of the day, the decision makers can use that collaborative and collective information to better manage the risks overall. And I think these sort of tensions are maybe where we need to focus some of our discussions on how do you actually break them down and make them constructive, rather than people wanting to defend the whole time, because there's international pressure which is difficult to respond to if you're struggling to find out the basics on the ground. So I just wanted to make that as a discussion point example. Thank you.
Thank you. Lucille, might you want to speak to that? Observation by Holly. Okay, maybe I can just speak to your observation comments, Holly. I think this is a moment for reflection for everybody. There's been a sudden shock to various systems, and there is no better way than instituting measures for strengthening dialogue. And speaking for Khaza, this is taking place at different levels, and one of the initiatives that we are hopefully going to see concluded soon is how we can elevate one of the laboratories within the landscape, becoming a center of excellence for forensics and animal diseases, wildlife diseases. And by so doing, if the partner states are agreeable to that and are willing to support that vision, then it becomes possible for the experts at the lab and also their partners across the boundaries to easily work together and facilitate the transportation of the samples in this particular instance. But I think this should not be restricted to wildlife diseases. It's just a question of how well we can work together, how well the different entities, institutions can work together. And it's about really opening up to information sharing. Yeah, thank you. Okay, I see several questions here. Clara, could you help me? Just check.
Sure. I'm just going to summarize issues that are coming up. So from Lisa van Dongen, she said there was examples from the mining sectors of collaboration coming up between different sectors and institutions because of the pandemic. So she was wondering if the fact that we had lockdown so ahead of time, and then we still sort of waiting for the major peak to happen, might have dampened the kind of idea of collaboration, and it might come back later as the health crisis develops. So that's a question. Paul, more on the SADC context, why, if most of the protocols encourage collaboration, including data sharing, this is very difficult country-wise to put into practice. Hugo is a PhD student from France. Hugo is suggesting that he's read several articles about the impact that COVID has had on poaching, meaning that he's read that he's on a surge, which I don't know if somebody wants to comment on. And he's asking if there are enough means to collect data on these issues and the impact thereof, and how can TFCAs manage this to conciliate economic needs of local communities and conservation goals. Relating to this and about local communities is that from Tribute, the questions around the informal movements of people across border, which of course happened in and around TFCAs, and how are parks agencies navigating this during the pandemic, if they're monitoring or whatever. And so these are the ones. And then I think Martin has one that is more for like a conclusive remark around what are the windows of opportunity that TFCAs practitioners can look at going forward. And I will I'm sorry for taking the advantage of the word that you've given me, Nyambe, but I would like to add to that, looking at the comments specifically from Lucilla and Joe, if there is a way in which we can start to put together this kind of working groups, because from the experience that we see, of course, it's the breaking of the boundaries even between us that are important. And if that is the case, I would like to also hear from the experience of people running regional programs like Joe is, like New Number are, and there are other people in the group that are involved as private sectors or NGOs or governments in running international and regional programs for conservation. How do they see going forward the need for more cooperative and sort of multi-agency involvement in resolving the issues of health and ecosystem health? Thank you.
Okay, thank you very much for that. Maybe I'll go back to the panelists before we get back to the raised hands. I can see 2 raised hands. Panelists?
Okay, so maybe there's a point that I'd like to make. When these pandemics or epidemics or public health emergencies happen, the focus is on human health, saving lives, the economic downturns, the social impacts, and people do not think back to where did these come from? How do we prevent them going forward? Is it about what is the role of healthy ecosystems in these areas where there's relationship between people, the environment, and animals, TFCAs. It's long forgotten. We need to bring the conversation back to where these may emerge and what role we can play and in reducing further incidents like this. So it's reminding people they don't just happen like that. There has to be a source, and we have to address that source and make things, try and make healthier ecosystems. It's really what Marcus said. I don't think anybody now as part of the pandemic is thinking around that at all.
Thank you very much, Lucille. Maybe at this moment, we have 2 raised hands. Let me begin with Harry. Over to you, Harry.
Thank you, Mr. Chairman, for giving me the floor. I think it's a very interesting discussion. I think coming back to how can you make things happen on the ground, I think one of the big challenges in transboundary collaboration has been for a long time what is being determined on a national or a transnational level, and what is being done on the ground. And that balance is always very difficult when it is necessary to come to a formal agreement on the national level. And I think what is most helpful for transboundary collaboration is if at a national level there is a kind of a framework agreement indicating what is allowed and not allowed, and leave it up to the ground level to determine what that means in a practical sense. And I think that people on the ground are very often limited by that there is discussion going on about this. There is no formal agreement. There is a formal agreement that is trying to cover all kind of different situations and thereby very limiting. So I would just very much encourage to see that in discussions on international level or transboundary level in the SADC TFCA, to say, can we come up to an agreement about the general framework and then leave it really up to the practitioners to achieve what needs to happen on the ground. And earlier this week in the presentation on Tuesday, as examples of transboundary collaboration, what is always mentioned is Glacier National Park and Lake Waterton between the United States and Canada. But if you start looking on the ground, and I don't know what the situation is right now, but just after, it must have been 2001, I visited the site. You enter the park, you get a very nice newsletter about how long ago this agreement was signed and what the wonderful collaboration is. Now you start talking to people on the ground, the researchers. There is research being done on one side of the border, and the researchers are not allowed to cross. There is no collaboration with people on the other side of the border. So it's very nice window dressing about transboundary collaboration, but on the ground, it hardly doesn't mean anything. If you then look in comparison, for example, with the International Gorilla Conservation Program, what, not an ideal program, but if you look at the challenges that it faces in a war zone area, but built up from the ground, where people, where the rangers on the ground are working together and determined with permission from their headquarters to work together. And I think if you look at the data from a biological perspective, but also socioeconomic perspective, that program over the years has achieved a lot. And I think, as I said at the beginning, it's very much the balance between what is determined on a national level, what can you provide as an overarching framework, because the governments do have the right to be involved in that and to paint the bigger picture, but then leave it up to the ground to achieve. So thank you for allowing me to share this.
Thank you very much, Harry. Maybe before any one of the panelists can speak to your observations, can I ask Tawanda? I see a raised hand from Tawanda.
Thank you.
Tawanda, are you there? Okay.
I'm Tawanda Kudusa. I'm the Technical Advisor, Transfrontier Conservation Areas with SADC Secretariat. I wanted to take up all this very important observation regarding the exchange of information. As you might appreciate, because of this pandemic, there is so much confusion, and information is coming from all directions, and authenticity of information is questionable and so forth. I want to believe perhaps this forum where the experts actually come together and share information need to create certain recognizable institutions where information can be easily accessible. As SADC Secretariat, through the network itself, the TFCA network, we do have various platforms where information can actually be displayed and shared and be accessible. We also do have a newsletter, and through SADC, there's also a newsletter. So perhaps that can be a good platform. But it's important that we look at what are the structures that we have within the TFCAs that we can actually utilize to make sure that reliable information, up-to-date information is available for people to access. But it's also important to go to people on the ground that are directly affected by the pandemic, especially within the TFCAs, and find the mechanisms of sharing information and how they would respond and manage the impact of this pandemic. That is very crucial, I think. But I also wanted to indicate that TFCAs also present an opportunity to take heed of the call by the World Health Organization that the nations need to come together to address this global common enemy. And the TFCAs present a very good example where we can start off by bringing in countries together and address a common enemy. It can also include any other future global disasters that we can face. Thank you for that. Thank you for listening to me and giving me this opportunity.
Thank you very much. And then I see a comment. I notice we have about 12 minutes to go. I see a comment from Kevin concerning the role of joint management plans and how these speak to those areas which require cross-border collaboration within the context of international agreements. Could any one of the panelists speak to that?
I can just speak briefly on my own experience from the veterinary committees that I've been involved with, where we do have integrated and clearly defined objectives that highlight priorities in different countries to be achieved. And that falls in under the joint management plans for the greater transfrontier conservation areas. But I just have to go back to the point again where those are discussed at meetings and they are agreed to generally by all the parties involved. But then when you actually want to action them across boundaries, then those roadblocks come up again where you just can't move easily across the boundaries. So I think, the speaker who spoke about the framework in which you're allowed to work across the boundaries developed by each nation and agreed at the TFCA Secretariat, and then allowing the practitioners to actually do the implementation is, for me, a very functional way of approaching this, because without people actually interacting across boundaries with each other in projects that are dealing with cross-boundary outcomes, it's all talk and very little real impact in the long term. And we do want to have transfrontier conservation areas, and we may want to rename it in the future, rather say it's a transboundary collaboration for sustainable land use practices or something like that, where the ecological functionality doesn't stop at a boundary. So one country has a lot of resources that are healthy compared to another country that has none. And then you start getting that disjunct between wealth and livelihoods, and then crime starts developing very quickly, because criminals do not respect boundaries. They find ways around the bureaucracy, and they're actually very efficient at doing so. So what we really need to strive towards is enabling people that want to do the legal and the constructive work to be almost given incentives to do that, and then find better ways to disincentivize the illegal activities that so commonly hamper good development opportunities in transfrontier conservation areas. Thank you.
Okay, thank you, Marcus.
Thanks.
Yes, yeah, please. Yes, go ahead.
Just follow on from that and pick up on some of, well, two questions actually. The point around, have there been any positive outcomes? Also some of the questions about poaching. So I think an unanticipated outcome in South Africa through April and May has been a dramatic, really dramatic decline in the level of rhino poaching. And whether that be through reduced access into the parks, particularly Kruger, the centre of Kruger, or reduced opportunity to export products, I don't think we know, and I think is worthy of a bit more investigation. Obviously, we can't keep the country under very severe lockdown indefinitely in order to achieve such an outcome, but if we could identify what those specific pinch points have been and try to find a way to sustain that going forward, I think that could be quite interesting and quite useful. And to pick up on the bushmeat poaching snaring side of things, I think this is a really good question, and it comes down to the point on data and evidence and information again. It's something everybody is speculating will happen, and we're hearing reported at a local level in lots of different places, but I think this would be an interesting and key question for someone to pull together evidence on and patterns on, to try and understand, again, what is going on and how best to address that.
Okay, thank you, Joan. We have about 10 minutes to go, and I would like to come back to the panelists. I have heard from, I think, Marcus, the point that maybe COVID is threatening or even accelerating the loss of the hard-earned conservation and development gains of the last 30 years or so. Could any one of you please speak to this issue?
Again, like I reiterated in the comments I made earlier, is that the COVID pandemic, particularly the lockdown rules, has made it almost impossible to cross boundaries. And maybe this gives us an opportunity going forward, once the lockdown starts lifting, that maybe in those discussions, the transboundary movement for particularly, projects that require that to happen, and I would very much like to see health issues being a core focus of transboundary collaboration, that one can create a framework in which that does happen, even if you have a pandemic, because if you can get experts to work collaboratively together, managing risks, which mostly you can do with these diseases, it's not impossible to do that, then one can maybe use this as a positive opportunity to create better frameworks in the very near future and for the better functioning of transfrontier conservation areas. And I'm sure, Lucille, you'll agree with me that from a human health point of view, that's also very important.
Yeah, I think COVID-19 has to be a wake-up call for human health, and to recognize how one could reduce the chances of this happening again. And TFCAs, One Health interfaces are critical in to address.
Thank you, Lucille. Joe, might you want to speak to this question on whether or not COVID could be threatening the gains in conservation development over the last 30 years or so?
Yeah, thanks. I think just to go back to the points I made earlier, there's also the economic concerns. So not just the loss of revenue from tourism, but the greater pressures for the likelihood of a global recession and the increased demands for health and other needs from support from international donors. So at the moment, very negative repercussions on the operating of protected and conserved areas. Is this another potential catalyst for us to look at innovative conservation funding mechanism, financing mechanisms going forward? We've been very reliant on tourism. It's not a solution at the moment. Whose responsibility is it to support these areas? And are there new ways we can look at this for Southern Africa, but globally going forward?
Okay, thank you. Yeah, I think let me just share an experience here from CASA, something that I learned of, I think, early this year. And I was amazed at what some private donors are doing in terms of malaria control at a transboundary level. And they actually invited CASA to join the support of this initiative. So I think there are other initiatives that are happening, but we may be not aware of because they're taking place in certain sectors like the health sector. And I think this silo approach will keep causing a lot of problems for us, and we need to find ways of dealing with that. And yeah, moving on, again for the panelists, I noticed that obviously when we're talking pandemics and COVID in particular, we may need to prioritize certain things. What might you see as major priorities within the context of TFCAs for the coming 20 years? This is an open question to any one of you.
I will maybe attempt just very quickly to talk about what I think is going to be important. I think we do need to have a system where people can use a cross-boundary structure like a transfrontier conservation area to actually allow business and project development to happen almost seamlessly across those boundaries, so that people can actually start looking at multiple ways of creating sustainable livelihoods. And in 20 years' time, a very beautiful picture for me would be, an area where there's healthy populations of people with their agriculture. There's nothing as proud, in my opinion, as a community member that has got a well-producing farmland that he can support his families with and earn some income. At the same time, there's wildlife that can move through corridors and is tolerated in areas where more human habitation takes place. and their core wildlife areas. And this should all be in the interest of the region, not just of each nation's involved. And most TFCAs have got very strong, irregularly distributed sources of wealth. Some have more farming practices, others have got more wildlife. And being able to create a platform where all of that is distributed a little bit more equitably, so that people that live in those areas genuinely benefit from those cross-boundary functionality, and not just the international guests that up until now to a large degree have been the main beneficiaries of conservation areas, but that the people that live there genuinely look after it themselves and benefit from it. That would be a wonderful picture to see in 20 years' time if we use these dramatic events of this time to learn some lessons about how we have to have multiple ways of creating livelihood opportunities and not just rely on one or two. Thank you.
Thank you.
Thanks. I would only maybe add to that, Marcus, that in 30 years' time, the population of Africa could reach 2.5 billion by 2050. So double what it is today. And for us to achieve that vision with so many more people around almost requires us to start thinking now about what the landscape will look like, having good land use planning in place so that we can achieve this, not with how things look today, but how they will look in 2020.
Thank you. Lucille.
Yeah, I buy into those dreams. I wish human health side would go away from their silos and buy into this future. Thank you.
Thank you. I think we've pretty much come to the end of this webinar, and I want to thank the presenters. And I think before I take you back to Clara, who's going to close the session for us, I just want to read something that probably resonates with all of us here. It's a statement from a book titled Presence. And the authors were discussing how they went about writing the book, and they were talking about the plight of humanity. And one of them said, whatever beings might take our place here in the future, we'll probably say, just like human beings, too bad they didn't have the adaptive capability of dinosaurs. So Clara, thank you very much, and thank you very much to all the listeners. Over to you, Clara.
Thank you, Nyambe. Thank you, Joe. Thank you very much, Lucille, for having given us your time in these very delicate and complex situations for you particularly. And thank you, Marcus, for your time this afternoon as well. Thank you to everybody that participated. And just by way of saying goodbye, can we all please share our videos so that we can wave goodbye to each other and see you again next week. Bye-bye. Sign up for the next one.
Bye.
Bye, everybody. Thank you.
Bye.
Don't be shy. Show us your faces.
Hi, everybody.
Hi, Ollie. Have a good afternoon.
Bye, everybody. Thanks. It was great.
Bye.
Thank you. Bye-bye. Bye-bye.
Thanks, everybody. Great job.
Be safe.
Very good.
See you in the next webinar.
See you again on Tuesday, and then for a deep learning on Thursday. Every week until the middle of September. Long journey.
Stay safe, y'all.
Clara, thanks. Thanks, Dr. Nyambe.
Okay,
Thank you,
bye-bye.
Tawanda.
Bye.
Bye. Bye, Maria Gracia.
Bye, Clara.
Oh, Patience, you look very interesting.
Patience, I didn't recognize you in traditional clothing. That's awesome.
Okay. Okay, shall we stop the recording?
Yes.
Okay. All right, Clara, thanks so much. Well done. Really nice.